Ever since the commencement of the dissemination of information on HIV/AIDS to the public, the twin evils of stigma and discrimination have left an ugly imprint on the lives of victims of the virus. This very act is an infringement of several human rights of individuals. On Tuesday, the Joint United Nations Programme on HIV/AIDS, UNAIDS, launched a global 2016-21 strategy which is aimed to tackle various issues of HIV/AIDS.
Regarding the people living with HIV and the key populations and also others affected by HIV, so that they don't have discrimination, they don't have stigma against them, even including in the health sector. Sometimes we assume that for us, where the health services are necessarily free from showing stigma and discrimination. Sometimes it may be what you think is not overt. I mean, for instance, referring to somebody living with HIV as a case in front of others, It may not appear to the health worker as something that you shouldn't say or you shouldn't do, but you can imagine the impact on the person living with HIV.
The launching was held at the Grand Coastal Inn, where Minister within the Ministry of Public Health, Dr. Karen Cummins, said HIV/AIDS in Guyana is no more seen as a death sentence.
Over a decade ago, HIV in Guyana was viewed as a death sentence. HIV was shattering families, communities, and development. With united efforts of the people of Guyana and their partners, significant efforts were put in place to ensure that people have access to life-saving medicine.
The HIV/AIDS response has brought light to the level of discriminatory practices against its victims.
The HIV and AIDS response has brought to the light the darkness of discrimination, and none of this could have happened without the leadership of people living with HIV and the implementers on the ground who believe that we could effectively fight stigma and discrimination.
Minister Cummins continued highlighting some measures taken by the ministry to give hope to HIV victims.
Treatment sites covering all 10 regions of Guyana. A total of 5,041 persons, or 55.8% females and 44.2 males, were listed on the register in the care and treatment program at the end of 2014. With 4,295 receiving antiretroviral treatment, which translates to a coverage of approximately 1/2 of the people, or 50%, living with HIV.
One aim of the strategy is to break down the social barrier of stigma and discrimination towards people living with HIV. This is set to lead an enabling environment to fast-track the response. For HGP Nightly News, I'm Jessica Daw.